Hi, this is going to be a short video on the CYP450 group of enzymes and why I think it's an extremely underrated topic that isn't taught well in most colleges. In fact, if I look around YouTube to find a video to learn this topic from, I am usually stuck with enzyme inducers and inhibitor mnemonics that people just memorize a bunch of drugs and hope for the best to solve a bunch of MCQs. Or you come across biochemistry videos that go in super detail about the whole enzyme, the pharmacology of the enzyme, which go straight over your head and you haven't learned anything. So this is going to be my attempt to simplify what you need to know as a medical student. Okay, let's break it down, let's simplify it. What is the first most important thing that you need to know? And it's going to be this line. The CYP450 group of enzymes are responsible for the metabolism of most drugs seen in clinical practice. In fact, 6 of them out of more than 50 CYPs metabolize more than 90% of drugs. That is a huge number that you should know. They metabolize more than 90% of drugs. Everything, you should be concerned with this all the time. So now that we know why it's important, because it deals with the metabolism of drugs that patients and people consume, let's start with where the drug is found. Even this one comes intuitively once you know this fact. Anywhere where the body might have to metabolize a foreign drug is where the enzyme is found. So a patient takes a tablet, it goes into their intestines. The small intestine does have CYP450s. After that comes the liver. That is where we have the highest number of CYP450 enzymes. Apart from this, there is also the lungs, because people inhale certain drugs, wink wink, into the body, and that has to be metabolized as well. After that, we get the kidneys and placenta, which also contain the CYP450s. So what do? They do a lot of things, but to keep it simple and focus on this particular topic, for medical students, let's just say they metabolize foreign drugs. They metabolize 90% of drugs. Okay, so there are just 3 points that I need you to know. The first one, I want you to consider if 100 patients take one kind of tablet, you will find that some of them didn't have any desired effect. Some of them experience the desired effect, while others experience adverse effects. So technically speaking, the adverse effects occurred because the patient crossed a certain level of desired effect into undesired effect. One of the reasons behind this is that some people process the drug faster than other people. Some people process the drug slower than other people. When they process it slower, the level of the drug rises above, going above the therapeutic level into the undesired level. And some people metabolize the drug really fast, and so they never really reach the therapeutic level and they remain below that level. So no effect is seen. The second point is understanding that the speed at which the CYP450s metabolize a drug is interfered by the presence of another drug. These are the enzyme inducers and inhibitors people keep talking about that interfere with how this enzyme works, causing it to process other drugs faster or slower. And the third point is what you should be doing about this. So in practice, if any patient is on long-term medication for any chronic illness, it should raise your ears as to what other medications the patient is taking, what other medications you are planning on prescribing, and how they interfere with the metabolism of that drug. So the most famous and most important examples are these. Number one is going to be warfarin. It's a blood thinner. It's an anticoagulant that is used for patients who have chronic atrial fibrillation because they are at a high risk of developing blood clots. So we need to give them anticoagulants. Warfarin is infamous for having a very narrow therapeutic range. It doesn't work if you take a dose slightly lesser than required, and if it goes slightly above that dose, patients tend to experience bleeding as an adverse effect. The second one is going to be completely normal, healthy women who take oral contraceptive pills. A patient might come to you who has had a few seizures, maybe needs to be put on anti-epileptics. So you forget to ask about a history of contraceptive use or if they are currently taking contraceptives. You prescribe them carbamazepine, and next thing you know, a few months down the line, they have a pregnancy. And they come to you saying, how could this have happened? I have been taking my oral contraceptives as I always have, and now I have a pregnancy. This is because of carbamazepine. It's an enzyme inducer, and it speeds up the rate at which CYP450 enzymes work, leading to lower than therapeutic level of the contraceptive drug. Another example is going to be patients who have seizures, and so they need to take anti-epileptic medications every day. Hypertensives, heart failure patients who take their heart medication every day. All of those medications should be glowing on the page as to what other drugs interfere with the processing of these. Now, I don't have a fancy mnemonic to help you memorize these drugs. Frankly speaking, if 90% of drugs are metabolized by CYPs, then 90% of them are on the list for enzyme inducers or inhibitors. Some of them are inhibitors, some of them are inducers. So it's not really possible for you to memorize all of them anyway. Your focus can be in two areas. One is learning the substrates of importance. As I mentioned, these substrates are contraceptive pills, anti-epileptics, anticoagulants, heart failure and hypertension medications. These are all the drugs that should be priority for you in terms of the CYPs, because the list that you will commonly find, sickfaces.com and crab GPS induces my rage. Those, frankly, are the most common interactions or inducers and inhibitors, and the most important ones. So that list will do, but there are a lot more drugs that are not included within any mnemonic and never will be, but have to be seen as inducers, potential inducers and inhibitors of the CYPs. So what I can do is actually make a small model that maybe visually helps you solidify the whole concept of inducers and inhibitors.